Okay, thank you. First of all, I wish to thank the organizers, Dr. Fiala and all the other organizers, and the audience for their patience. My name is Marco Ruggiero. I am an MD and PhD. I am a clinical radiologist, and I am a full professor of molecular biology. But today, I won't bore you with molecular biology of AIDS or HIV. I want to present some novel data that we are producing now. And I am lucky enough to come from a country whose public health system has been constantly rated among the best, the second best in the world. The first one appears to be France, and the second Italy, and also Austria is doing quite well. And you may say, what has this to do with what I'm saying? I will tell you at the end. But I also have to say that in the past few years, we have enjoyed an extraordinary freedom of thought, research, and speech in our country. And as a matter of fact, I teach a course, an official course at the university entitled Chemical AIDS, chemical instead of viral or HIV-related AIDS. And I will show you that this is posted in the official website. And also a scientific society, a prestigious one, the Italian Society of Anatomy and Histology, has accepted to publish some papers questioning the dogma in its official publication. And this is a peer-reviewed and abstract in PubMed publication. So it's these are full papers. One has been published by our group, another one has been published by Professor Bauer. I will not bore you with this. This is the official course on chemical AIDS and the abstract in PubMed. And here you can find all the slides. And if you are interested in this course of teaching, you can go at this website and look at that. But today's slides, many of today's slides have been provided by the public health system of the region of Tuscany. And I thank Dr. Veronica Casotto, who gave me the authorization to present those slides, their slides, at this very meeting, and again highlighting the support that we receive from the official institutions of Italy. And this presentation has been given just a few days ago on June the 10th, and I will use some of their slides just to make some point. As I told you, we can teach freely these opinions of ours at our university. And let's start with a stronghold of dissident opinions or HIV skeptics' opinions, that is the lack of correlation between HIV and AIDS numbers. This is a thesis that has been discussed on July the 14th, 3 days ago, at the University of Florence. Professor Bauer is one of the tutors of this thesis, and there are many points, but one of the points is what we have been hearing of today, lack of correlation between HIV numbers and AIDS numbers. This has been discussed about African AIDS and AIDS in other parts of the world, but I want to focus on the numbers that we have in our region of Tuscany. Why this choice? Because I know the epidemiologists and the statisticians who performed this analysis. I trust them, and these numbers can be relied upon, so we can trust these numbers. Well, let's see. In Tuscany, the male-to-female ratio for AIDS, now we're talking about AIDS, not HIV infection, but just diagnosis of AIDS, has remained constant for the past 26, 27 years. Professor Bauer has already talked about this in general, and now we look at the real data that we can trust. So the ratio is 3.6 males to 1 female for the past years. However, and you can see here, in the years where we had the highest numbers of AIDS cases, and nowadays when the cases are much less, the blue line is a male and the red line is female. You always see this 3.6 to 1 ratio. However, the purported mode of transmission changed drastically. At the beginning of the so-called epidemics, about 8% of HIV was being transmitted heterosexually, whereas in the end of the epidemics nowadays, about 44% is being transmitted among heterosexuals. So here we have these curves that come from the Public Health Service. At the beginning, these red dots stand for toxicodependent, which means drug addict or intravenous drug users. At the beginning, most of HIV was transmitted among people sharing dirty needles, and a minority heterosexual unprotected intercourses, and nowadays we see the other way around. So the minority through sharing of dirty needles or among drug users, and the majority among heterosexuals. So we are talking about 8 cases and the purported mode of transmission. And this place a very curious constraint on how infections through dirty needles occurred in males and females respectively. In other words, you would expect that by changing the mode of transmission, the ratio male to female would have changed, and this has not happened. So this is one of the so-called paradoxes, the so-called demographic paradoxes that cannot be fully explained by the so-called dogma HIV equal AIDS. But we see that this also happens with new HIV infections, so not only with AIDS, the syndrome in itself, but also with the infection. These data come from all over Italy. These are national data, because until last year, not every region of Italy had implemented an official registry of new HIV infection, but we see exactly the same, that the relative rates of HIV positive among males and females has remained the same. However, the mode of transmission has changed drastically. So here we see, when we look at just HIV, that there is this ratio male to female again, but as in Tuscany, the supposed mode of becoming HIV positive changed. At the beginning, it was about 75% drug-related, that is in the group of drug addicts, and only 5% was at the end. In sexual transmission increased from 10% at the beginning to 80% at the end. So this is very complicated, and it's not very nice. This has been produced by the Ministry of Health, but if you go into detail, it is written in Italian, and I left these as original as they were. I did not modify them, just to give you the idea that I'm using official data for which I've been given permission to use. So this says the same, that also for new HIV infection, we have seen a dramatic change of the mode of transmission, but the male to female ratio has always remained the same. And this is very difficult to interpret. Now, let's look at the sexual transmission. Yesterday, Dr. Fiala, and today Professor Bauer, have underlined the concept that the level of promiscuity that is needed to explain the African prevalence of HIV positive is impossible. It's very difficult to be envisaged. And also that there are doubts about sexual transmission of the disease. Well, we looked at the most recent data that were collected in our region about sexual behaviors of teenagers and other data that I will show you. And again, I trust 100% those data because I know how they were collected and they were reliable. Actually, the 2 kids of mine also answered to those questions, by the way, so I know firsthand that those data were collected properly. So let's talk about teenage sex in Tuscany. And this is somehow discouraging on some part or amusing on the other part. But I will show you that 43.5% of teenagers has had complete sexual intercourses within their teenage days, 13, 14. I will show you the data in just a moment. And about 40% of males and 26% of females have or declare to have more than 3 partners. And if declare this, it is difficult to think that this is underestimated. Usually you tend to overestimate or the other way around. Anyway, this is what they declare. And it is interesting to notice that among females, I would say little girls who declare to have more than 3 partners, the majority of them, 55%, do not use condoms. And in general, whether you have one or more partners, 40% of female teenagers do not use condoms. This is a total failure of whatever campaign has ever been done, but this is what teenagers report, and it corresponds to the truth. So you see that the mean age of sexual intercourses begin at 13, and it has a peak between 14 and 17. And the number of partners, these are teenagers, in red are female, in blue are males, who declare only one partner, those who declare two, and it is curious to see that the minority declares two, and a significant percentage declare to have had more than 3 partners within this age range. I don't know how do you label this, whether sexual promiscuity or not, but I would rather label this behavior as a risky behavior and a certain level of sexual promiscuity. And also, here we see that the more partner these little girls have, the less condom they use. I don't know whether they are expensive or what is the reason for this curious behavior, but it is curious that these little girls quite obviously did not listen to anybody, and the more partners they have, the less condom they use. This is the percentage of girls using condom. Males, maybe they're more afraid or they listen to their mothers more, I don't know, and they use a little bit more condoms. But little girls, they don't use condoms, and more partners they have, the less condom you use. And so you see 55% do not use condoms. I think that you can label this as a risky behavior because these are unprotected sexual intercourses. It is a risky sexual behavior, and there is a certain level, a certain degree of promiscuity in our region. And this data can be easily confirmed if you talk with whatever parent at the exit of the high school. And each parent will tell you the same story that is here, that is reported here with a statistical method. Now, let's look at the mean age of the new HIV diagnosis. Professor Bauer already showed you those data. These are these are real people, are not extrapolation, these are not estimates, these are real data. And you see, all over Italy, this refers to the entire nation Republic of Italy, the mean age for new HIV infection is 34. Not 13, not 14. It's 34 for females and 38 for males. And the same holds true for AIDS. And this also highlights another paradox, the absence of latency that Professor Bauer just mentioned a few hours ago. So let's go back to the Tuscanian data that we can rely upon. These are not estimates. These numbers correspond to names of people. These are real people. And you see that the mean age of new AIDS cases is concentrated from the 3rd decade of life until the 5th decade of life. And among teenagers, the numbers are negligible, is the statistical 0. And you see AIDS cases here in the, I would say, I'm not labeling myself as a middle-aged man, but anyway, when you're 50, you are not a teenager anymore, that's for sure. And the mean age, again, in Tuscany, for AIDS cases, it goes up, and still there is this 4-to-1 or less ratio male to female. So all these data are confirmed, but these are very difficult to explain. And there could be many, many reasons for these drifts, upward drifts in mean age. Could be the composition, the changing of the composition of the population that are tested, could be changes in the tests themselves, but certainly they are inconsistent with what one expects for a sexually transmitted condition. And in particular, for a sexually transmitted condition about whose dangers the propaganda has been so intense. And as a matter of fact, unless you are a Rolling Stone, they are very old, but they still behave, they still live a very risky lifestyle. You should be less at the mercy of pheromones and hormones, and you should learn from experience to behave less destructively. And they should become less and not more likely to contract this sexual disease if this was a sexual disease, unless we believe that those adult people now that have HIV or AIDS in Tuscany, they never listened to all the panic and the propaganda for the past 26 years. And that is, we, mature adults, for about 26 years have been exposed to propaganda, and from those data, if we believe the interpretation, the data are true, the interpretation is debatable, we are those who act as foolishly as we can, and even worse than the teenagers, at least the Tuscanian teenagers, I don't know, in other countries. However, you could say, look, you could get HIV at the age of 13 or 14 because you engage in risky sexual behavior, as we see that unfortunately our kids do. But you do not test for HIV at that age, for whatever reason, and when you test for HIV and you test positive, you take drugs before the onset of symptoms, and this is because the diagnosis of AIDS is made when you are much older. So this could also be interpreted as a success of antiretroviral therapy given prior to the diagnosis of AIDS. So this could be an interpretation. Is this true? Well, no, it is not true. The data from the region of Tuscany tells us that this interpretation is not true, at least in Tuscany. Because let's look at the use of antiretroviral drugs and death rates in Tuscany. This is a typical old picture of AZT. It is very toxic, we know all this. But it appears that a significant percentage of HIV-positive subjects in Tuscany is well aware of the risk and the side effects of antiretroviral therapy, and it appears, I will demonstrate, that a significant percentage, I would say half of them, deliberately chooses not to use antiretroviral drugs. And later on, we shall see what happens to them. So this is just one of the innumerable slides telling you all the risk of these drugs, like any other drugs, but these are particularly toxic. And let's look at the people who have been diagnosed AIDS. So here we have people who have been diagnosed AIDS, and they have been asked whether they used antiretroviral drugs before the diagnosis of AIDS. These are divided in three groups: those who acquired the virus supposedly through homosexual intercourses, drug abusers, and heterosexual intercourses. Let's concentrate for a while on those who declare to have had heterosexual, risky, unprotected intercourses, and presumably that was the way they were infected by HIV. When they are asked whether they took antiretroviral drugs prior to the onset of symptoms, that is, the diagnosis of AIDS, we see that only 17% of them did, and more than 80% did not take drugs. You may say, well, they didn't know to be HIV positive, and for this very reason, they didn't take drugs. This makes sense. If you don't know to be HIV positive, no one tells you to take drugs. So could it be that 80% of new AIDS diagnoses were unaware of their serostatus? No, because these data, again from the region of Tuscany, tell you that at the moment of the diagnosis, 44.5% knew about their serostatus. That is, they knew, among heterosexuals, they knew to be HIV positive, and evidently, so they knew to be HIV positive, they chose not to take drugs. Let's see we shall see what happens to them later on, but let's see a totally opposite behavior in drug users. So let's concentrate on drug users, and we see that 90% of drug users know to be HIV positive. This is logical. They know that injecting drugs is a risky behavior for HIV, and they have the test in a much higher percentage than heterosexuals who might have had some unprotected intercourses. So 90% of those people who have diagnosed AIDS, they knew to be HIV positive before the diagnosis of AIDS. And a significant percentage of them, that is about 57% of them, choose to use antiretroviral drugs before the diagnosis of AIDS. You see that the two figures are completely different. And I can say that a higher percentage, but again, not 100%. So not all the drug users who knew to be HIV positive decided to use antiretroviral drugs before the diagnosis of AIDS. Only 57%, which is much higher than 17% among heterosexuals, but still it is not 100%. And what happens to them? Unfortunately, it happens to them that they die. And this is written in Italian, and I left it this way. I will translate it for you word by word, because these are the words from the official public health system of Italy. And it says, in the period after introduction of antiretroviral therapy, the probability of survival in the group TD stands for drug addicts is significantly lower. And then they try to interpret this. I don't know if Dr. Casotto had read Professor Duisberg's paper, but they say maybe this could be attributed to the toxic effect of drugs on the immune system or whatever else. And so this is the official interpretation of the region of Tuscany. These are the curves, so these are drug users. And the other two groups, homosexual, those who claim to have acquired the virus through homosexual intercourse or through heterosexual intercourses, and who do not assume antiretroviral drugs prior to the diagnosis of AIDS, well, they die much less. They have a higher probability of survival. Well, this is a nice picture we took a few weeks ago when we were at the beach. This is the coast of Tuscany, just in front of the Elba Island. It's called the Talamone, small peninsula, very nice. So I invite you to come and visit Tuscany, and should you be afraid of visiting Tuscany because of HIV or AIDS, you already saw how foolishly Tuscanian teenagers behave about sex. So should you be afraid for your kids if you come and visit our beautiful region? Well, let's look at the numbers again. In Tuscany, we are about 4 million people. Last year, 7 people, regrettably, died of AIDS. The year before, 2 people, regrettably, died of AIDS. These are precise diagnoses. These are not people who were HIV positive and died of a heart attack. These are accurate diagnoses of AIDS. And this is the statistical zero. 2 people in 1 year out of 4 million people is a statistical zero. Lethality rate is 0 point something. 7 people, again, is a statistical zero. Many more people die because they've been bitten by their dog or some other trivial accidents. Well, unfortunately, that's true. And we regret those deaths for sure, but this is the statistical zero. So we can say that despite all that risky behavior about sex, and despite the regrettable use of drugs, that there is a drug abuse in our region, unfortunately, the number of AIDS deaths is close to zero. And also despite the fact that people do not use antiretroviral drugs before the diagnosis of AIDS. I know you're hungry and I won't bore you for a long time, but I like a lot the French philosopher Jacques Derrida, and after the deconstruction, we have to build something. We cannot limit ourselves to deconstruct. That's easy. To deconstruct is extremely easy because you find a small paradox in whatever theory and you build on that. And you can do this with whatever theory you like. But I think we all agree, those who are here and those who are at the other conference, that there is a syndrome. I think that we all agree that the syndrome exists. Then we may disagree on the cause of the syndrome, but the syndrome exists. And people ask to be helped. And we try to help them. And here we quote, if I succeed, we quote the words of Professor Montagnier, who has been quoted many, many times. And he questioned his quoting, but anyway, these are instrumental for my talking, so I do not pretend that he actually remarks this statement, that our immune system will get rid of the virus within a few weeks if you have a good immune system. We have a laboratory, was established in 1928, and it is as much chaotic now as it was several 1 century ago. Anyway, this is the laboratory where we work, and we obtain some data that confirm the words of Professor Montagnier. In other words, Professor Montagnier, what he said, or how can his words be interpreted? That there is an association between signs of HIV infection. Here, I will not enter into the debate whether HIV exists or not. But I think that we may all agree that there are things, parameters, that are interpreted as signs of HIV infection, whatever they mean. And we all agree that there is an association between signs of HIV infection and the syndrome called AIDS. Is this a cause and effect relationship? Is HIV the cause of AIDS, or is it the other way around, as Professor Montagnier appeared to say, that is a deficient immune system will cause the permanence of the signs of HIV infection? In our laboratory, we had the opportunity to collaborate with a US scientist, actually he's from Japanese ancestry, Professor Nobuto Yamamoto from Philadelphia, who several years ago succeeded in purifying a factor, a protein. I cannot give you the details because this data will be presented on Thursday at the other conference, and I have to keep the embargo on the details, but they will be presented in just 3 days. So he purified the protein, which is a powerful stimulator of the immune system through the stimulation of the macrophages. That's why yesterday I asked you about macrophages, who are a major player in the function of the immune system. This US scientist purified this factor, has been using this factor in a variety of conditions where macrophage function is deficient, has obtained very, very interesting results, and he thinks that this factor will stimulate macrophage function, and from macrophage function, the entire immune system, if it is deficient for whatever reason, can be stimulated and can be restored, and a good degree of health can be regained. Actually, he published a small-scale clinical trial last year in the prestigious Journal of Medical Virology, again peer-reviewed and PubMed abstracted. And I can read you just a few. No, this is. Okay, these are the results. I've already been talking about the previous slides. These are the results, and I can read you just a few sentences from the abstract. This is available online, it's been published last year, and indicates eradication of HIV infection. Please notice, I don't know whether Professor Yamamoto can be labeled as a dissident or not, or whether he knows about all this debate. So he talks for short about HIV infection. I would have written signs of HIV infection, but this is just semantic if we understand each other. So, yeah, this is an enzymatic activity. I can tell you privately later on. No, it's not reverse transcriptase. It is not reverse transcriptase. Anyway, whatever this enzymatic activity is, you see, I had to obscure this part. I mean, it makes sense. I signed an embargo agreement, and I want to respect that. So whatever this HIV-specific or specific of signs of HIV infection, again, is, it decreases to the level of healthy control within 12 weeks of administration of this factor. And this has been published, so you can look at the paper. It is available, and it talks about eradication of HIV infection, which was also confirmed by something that I don't trust very much, but it was accepted, infectious center formation by provirus-inducing agent-treated patients in mononuclear cells. But it is interesting to notice that this clinical trial began, it was conducted in Nagasaki and Hyogo in Japan under the supervision of the local health authorities, universities, and hospitals, and all the protocols they are available online. And it is interesting to notice that no recurrence has been reported to occur and their healthy CD4 cell counts were maintained for 7 years. So this is not our discovery. This has already been published, has been approved by public health committees in Japan, and so I think we can trust these words. Our work began from here on because we provided the molecular mechanism explaining those results. These are just clinical results, and of course, to go ahead, they needed to provide molecular details. This is what we have done, and we shall present those data in about 3 or 4 days. I think I was within my time limit, and so we have time for questions if you have, or if you are too hungry, we can talk about this later. Anyway, before leaving, I wish to acknowledge again the organizers and the audience, and also, of course, I want to state here my gratitude to Professor Duisberg, whom I met about 23 years ago. We shared the office at the NIH. When he, if I have just 2 minutes, I was fast enough. He proposed to be injected with HIV-positive blood unless it didn't come from Gallo's laboratory. And when he left for the farewell party, we prepared him a syringe, a huge, big syringe filled with pink medium, so that could symbolize. And for about 25, 26 years, the dogmatists or the anti-dissident people say, why didn't he do this? Or why all dissidents don't try this experiment and they inject themselves with it? Well, this has been done several times, not out of purpose, and I don't know whether Professor Duisberg did it, but it would have failed. And if you have the patient to read one of those papers that is, again, peer-reviewed, PubMed, abstracted, that I show you at the beginning, you will find out that all the studies, not done by ourselves, but done by other people, demonstrate that the probability of seroconversion after accident with contaminated HIV-positive blood is 0 point something. That is, all healthcare workers, as Professor Bauer said, and all people performing dissections, that was our main interest, and all those who injected themselves with HIV-infected blood, out of all of them, none developed AIDS, and also a 0 point something percentage became HIV positive. So that experiment would not have worked. You could have injected that HIV-contaminated blood without any result anyway, unless you were a Tuscanian teenager. Maybe that was different. And finally, I thank Professor Duisberg, Professor Bauer, with whom I've been collaborating for these years, David Crow, who also organized a similar conference in November in Oakland, California, and gave me the opportunity also to meet many of you. And also I wish to thank heartfully the University of Florence that allows us to do this research, funds us, give us money to participate in this conference, to publish these papers, to do this research, and my department, of course, and the region of Tuscany that authorized me to use their slides, and of course the Ministry of Health that I talked about the Ministry of Health in Oakland, so I won't bore you with the Italian Ministry of Health, but is open-minded enough to give the opportunity to perform unconventional, I would say, or non-dogmatist research, and give us the opportunity to be here and talk about these things freely without any fear of being jailed, as apparently it happens in Berkeley. Thank you very much.